Hello everyone, hello dear students, welcome to Aprender a Estudar em Casa. I am your teacher, Leonilda de Barros. Remember, we are talking about disease, so don't forget COVID-19. What you shall do? What you must do? You must keep the social distance, wash your hands all the time, and wear the mask correctly when you are in public place. You protect yourself and you protect your loved ones as well. Dear ones, we are in a new lesson. So, are you ready to start? Come on and let's see what we have for today. Today, we have this. Can you read? Should or shouldn't. Repeat, should or shouldn't. Let's see what we have in our agenda. Can you come on and read with me? Talking about disease and giving advice and recommendation using should or should not. Remember that we are talking about hospital. It means we're still working on the unit 4 of your book. Okay, you can open your book and follow the lesson. So, since we are talking about hospital, can you tell me some vocabularies that you remember from the last class? Last class we talked about some disease, symptoms. We mentioned a specific disease that is that the whole world is facing nowadays. What disease is this? A very serious disease. It's COVID-19. We talked about COVID, the ways of preventing COVID-19, and we saw some other vocabularies related to the hospital. For example, can you tell me? Nurse, doctor, porter, operating room, medication, to be admitted. What means to be admitted? Is when you go to the hospital, you are sick, and you stay in the hospital for the treatment for some days, okay? Until you recover your health, then you go home. This is to be admitted. Now, let's see something that we have in our board. It's on your book, page number 69. Can you read? Did you know? This is a curious fact. What animal is that? Do you know the animal? Are you afraid of this animal? I'm very afraid of this. It's a snake. Yes, it's a snake. It's a wild animal. And it's a very dangerous animal, okay? But what the snake has to be with medicine or with hospital? Let's see. People use the oil of Chinese water snakes as medicine. You know what is a medicine? We saw in the previous lesson some types of medicine or medication, okay? Pills, injection, cream, syrups, okay? They use the oil of snake, Chinese snake, as medicine. And how did they use the oil? They used it for workers. After a long day of work, when their body is hurting, is paining, they put it in the joints. Joints are these parts of our body. This one and this one. This one is our joint, and this one as well is our joint. So they use it to help them with the pain they feel because of the long day of work. So, as you can see, snake is one of the symbols of pharmacy. You go to a pharmacy and you see the snake is a symbol of medicine. Did you know as well that the Nurses' Day is celebrated on May 12th? We are in April. It's just 1 month to celebrate the Day of the Nurses. I didn't know as well, okay? Now let's see what we have. In the previous lesson, we talked about the medications or the medicines. But today we're going to see 2 big groups of medication or medicine. Inside these 2 big groups is natural medications or medicines or herbs. You can see there, plants. We use them to heal or to cure our body from the diseases. And there is a synthetic medication or medicine, the ones that are made in factory and we buy at the pharmacy or drugstore. Look at these two types of medication or medicine and tell me what you think is the best, or which one you think is better for our health, to use the natural medication or the synthetic medication. Let's see more. Do you see the boy? His name is Bean. What is Bean doing? He's vomiting. It means that he's not feeling good. He has some problem. What do you recommend to Bean? To stay home? To take some tea? Some pills? What? To give advice and recommendations, we use one specific verb, that is should, in affirmative, and we use the negative form as well, that should not, okay? Do you remember in previous lesson, some days before, we talked about modal verbs? We talked about should, must, can, can't, may. So now we are mentioning them and studying it, what we use it specifically for. Should we use to give advice and recommendation. Should is affirmative and should not is negative. What are these? These are modal verbs, modal auxiliary verb. They are modal verbs and they are as well used as auxiliary verb, okay? That we use in English to give advice and recommendation. And also we use it to give suggestion. When you want to suggest something to someone, we use should or should not or shouldn't. See, should is used in affirmative and interrogative sentence. Let's see affirmative example. Bin, I think you should go to the hospital. You see, Bin is vomiting and we recommend him to go to the hospital. Interrogative example. Should Bin stay home and just take some pills? You see that Bin is feeling sick. Do you advise him to stay home and just take some pills, some medication, instead of going to the doctor? Let's see the structure of the interrogative sentence. What comes first? In interrogative sentence, you have should, then subject, then the verb. Should is a verb. Remember, should is an auxiliary verb. It means that we don't use only should. We use another verb that is called the main verb, the principal verb, okay? The principal verb is stay, and the auxiliary is should, okay? Should first, then subject, then the main verb. This is the structure of an interrogative sentence. Now let's see the negative form. We use should not or shouldn't. Should not is called the long form and shouldn't is the short form, okay? When we make the contrasting using apostrophe. Let's see, is used for negative sentence, of course. Let's see example. The mother told the child, you should not eat too much candy, you will get sick. The mom or the mother is advising the child not to eat too much candy. Remember we talked about diabetes? If we eat too much sweet, candy, lollipop, things that are sweet, we can have diabetes. That's why the mother is advising the child not to eat too much candy. Let's see the second example using the negative. Can you read with me? Soda contains too much sugar. You shouldn't drink it very often. Everybody knows that soda, Coca-Cola, and all these beverages, they are too sweet. That's why we should not drink them very often, many times, okay? It's better not to drink no time, but sometimes it's fine. Now, You have seen when we use should or should not. When you want to advise someone or to recommend something to someone, okay? Not only in the context of hospital or disease, okay? In other contexts too. You can recommend someone to go to a restaurant, for example, okay? You see a very nice restaurant and you recommend your friend, you should try the restaurant, that restaurant, because the food is delicious, okay? This is a recommendation. When you see someone doing bad things, you should advise the person, you should not do this because it's not good, okay? Giving advices and recommendations using should or shouldn't. Now, to see if you have learned it, if you understood the explanation, we are going to move for an exercise. All right, dear ones, let's do the exercise and check if you were paying attention, if you were really paying attention. And you can distinguish when you use should or should not. Let's read the sentences on the board and see which one you have to use. Fill in the blanks using should or shouldn't. Number 1, she has a toothache. She go to the dentist. Toothache, when you have a pain in your tooth, okay? Tony has backache. This is back. Tony has backache. He carry heavy bags or heavy things. Mayra has a flu. She stay home. Steve has stomach ache. He drink lemonade. Kate has cough. She drink cold water. They have headache. They take painkiller. Caroline has sore throat. She go to the doctor. Take your time and do the exercise. We will come back soon. Now it's correction time. Let's see what you have done in your exercise. Let's look at the board. Sentence number 1, she has a toothache. She should go to the dentist. Toothache, when you have an ache or pain in your teeth. Tony, number 2, Tony has backache. He shouldn't carry heavy things. Backache. Number 3, Mayra has a flu. She should stay home. Number 4, Steve has stomach ache. He shouldn't drink lemonade. Number 5, Katie has cough. She shouldn't drink cold water. Number 6, they have headache. They should take painkiller. Number 7, Caroline has sore throat. She should go to the doctor. Excellent job. Now we have finished our exercise. You were very, very good. Your homework is on your book, page number 70. You are going to perform, okay, Let's see, you are a doctor. You are going to be a doctor, and the patients come to you, okay, are coming to your office. What you have to do, you have to ask them about their condition and for how long they have felt it, the problems, and you are going to give some advice to them. Use the appropriate language, okay? Don't forget, we give advice using should or should not. You have Lillian. Lillian is one of the patient. You will write the other names. Condition, pain, back pain. She's feeling back pain. The duration, she has feeling back pain for 3 days. The advice you give her as a doctor is, should put some eyes on your back. Think about the other people and the other problems and provide the advice for the patients. Have a good job and show your job to your teacher at school. My loved ones, now is the time to summarize our lesson and to check if you have learned anything from our lesson today. Let's see, today we talked about what? Should or should not. For what we use them? We use them to make questions. Yes, we make question in affirmative or in the negative. For example, should I go to the doctor? This is affirmative question. Shouldn't I go to the doctor? This is a negative question. Do you understand? And as well, we use these two expressions or modal verbs to give advice and to give recommendation to someone. We have an example. Matt is fat. He should not eat junk food. If a person is fat, it means that this person should not eat junk food because he or she becomes more fat or fatter, okay? And the person gets health problem as well. Example 2, should I drink natural juice or milkshake? I'm asking to myself, I'm wondering to myself if I should drink natural juice or milkshake. It means I need someone to advise me or to give me a recommendation about it. Do you understand? Of course. Now we have finished our lesson for today. It was a pleasure to be with you. My dear students, we have finished our class of Aprender a Estudar em Casa for today. But I will see you in the next class. Have a good day. Goodbye.